able to be talking about these issues.
And the plot thickens further because, as our own Benji Sarlin reported today, an anti-vaccination activist in New Jersey says her organization goes way back with the governor, who purportedly sent them a letter in 2009 offering his support for families affected by autism. I'm quoting from what they say is a letter from him. Many of these families have expressed their concern over New Jersey's highest in the nation vaccine mandates. I stand with them now and will stand with them as their governor in their fight for greater parental involvement in vaccination decisions that affect their children. Now, Christie's office tried to walk back the comments the governor made earlier today, saying in a statement, to be clear, the governor believes vaccines are an important public health protection, and with a disease like measles, there's no question kids should be vaccinated. At the same time, different states require different degrees of vaccination, which is why he was calling for balance in which one's government should mandate. For observers of the hysteria over Ebola this past fall, there's something more than a little ironic about Governor Christie's iconoclastic stand for personal freedom in the face of a public health mandate. He is, after all, the same governor who implemented what was effectively a forcible quarantine against public health advice on someone who tested negative for Ebola. Remember that? Nurse Casey Hickox was confined to a makeshift detention center outside a New Jersey airport for 3 days in October after returning from treating Ebola patients in West Africa. In an exclusive interview today, Casey Hickox told me exactly what she thinks of the governor's comments on vaccination.
You know, I think this is a good example of Governor Christie making some very ill-informed statements. We heard it a lot during the Ebola discussion, and now it seems to have happened again, making these statements about vaccines and sort of balancing parental choice. And of course, a few hours later, his office had to come out with a statement to kind of mitigate some of his words. And I think the unfortunate thing, or the scary thing, is that I want a leader who consults experts and thinks about sort of all of the different sides to an issue before making statements and policies that are unfounded in science.
You had an experience in which it seemed to me, if I can editorialize for a moment, the governor had a choice between demagoguing in a way that might prove popular short-term by taking this kind of ham-fisted approach, or listening to experts who said there's no medical reason to do this quarantine. She hasn't tested positive for Ebola. And what did you learn about the governor based on your interaction with him and how he made that choice?
You know, I keep learning that I just, I don't see a lot of great leadership qualities in him. We need to consult medical and public health experts about these kind of decisions and discussions. And again, he's not doing that. Again, he's going against science. So before, he ignored science and is still ignoring science, because healthcare workers returning from Ebola-affected areas are still being required to in-home quarantine in his state, which I think is completely unfortunate and unscientific. But also, now he's saying, well, parents should be able to choose vaccines, and we have a real threat in America today. The outbreak that started in California has had over 100 cases in 14 states, and we've seen what measles can do if we allow the disease to continue to grow in the community. So we really need to advocate for vaccines.
Having worked up close at tremendous personal risk, I would add, in West Africa on the Ebola outbreak, an outbreak that does seem, thankfully, mercifully, to kind of possibly be in its waning stages. It looks like it's finally kind of being brought under control. What do you want to tell Americans about the stakes here, about what we maybe take for granted here in the U.S. about the efficacy of our public health system compared to a place like Liberia, for instance?
Yeah, we know that vaccines are safe, and we know that vaccines save lives. I have worked in a measles outbreak in northern Nigeria before. We were seeing about 2,000 children a week with measles, and it's a scary disease. I know that these families of these 100 people who have the disease now could tell you a little bit about what the disease looks like and how much misery it causes. After the vaccine was kind of implemented in 1963, there was a large reduction in cases, about 98%. And in, I believe it was 1989 to 91, there was a resurgence. So there were 55,000 cases in the U.S. and over 120 deaths. So the stakes are high. You know, we have to protect our most vulnerable populations, and vaccines against measles and whooping cough are really important and necessary.
Casey Hickox, nurse, current resident of the great state of Maine, if I'm not mistaken. Really